The first signs of aging on the face are likely to show up around the eyes. Laura Windsor has this report.
Whether caused by heredity, aging, illness, or accident, problems with how the eyes look can affect a person's appearance in general. We spoke with Dr. Amin Habash at Desert Regional Medical Center to find out more.
Blepharoplasty is just a technical term for eyelid surgery, and what we try to do is there's essentially multiple components of the eye that start to show evidence of aging, whether it's skin, muscle, fat, or a combination of those. And through a blepharoplasty, whether it's an upper eyelid surgery or lower eyelid surgery, we're able to address those different aspects of aging, eyelid aging or eye aging, and try to give a more youthful, most people come in complaining of a tired appearance, and what we try to do is maintain a natural appearance but just more youthful. The key thing here is maintaining the natural appearance of the eye. We don't want to alter the shape of the eye or any of those types of things, but we do want to remove the excess skin, remove any herniating fat or repositioned fat that has started to drop a little bit. So now, as we start to understand that facial aging, one of the components of facial aging is fat loss. What we do, instead of removing all the fat, we try to reposition it in a more natural, youthful position. And that maintains the fullness. We also address some of the excess skin or excess muscle that may be sort of redundant as we age, and try to just give a smoother appearance, not only of the upper eyelid, but the lower eyelid. Some people come in and their upper eyelids are their major concern, or the lower eyelids are the major concern, and we can do all four eyelids or just the upper or lower eyelids depending on the extent of concern of the patient. With the upper eyelid, it's a little bit more straightforward. We're usually just removing excess skin and muscle, really just getting rid of some of the fat that's herniated through because of some of the underlying structures have relaxed with age. The lower eyelid, it's a lot more technically challenging. You want to make sure that not only do we reposition the fat, really get rid of some of this tear trough deformity, but our lower eyelid will actually start to become more relaxed, and the corner of our eye will sometimes drop as we get older. So that's something we try to reposition. Once again, not trying to change the shape of the eye, but just repositioning that, what we call lateral canthus, or the lateral portion of the eye, in that more youthful position.
How quick is the recovery time for these types of procedures?
Generally speaking, most people have, a moderate amount of swelling and bruising. Men tend to swell and bruise a little bit more than women. What we do immediately post-op is we ice as much as possible and really keep them elevated. The stitches come out at about 5 days after surgery, and most people at 5 to 7 days are back into their normal routine.
Does insurance cover some of the procedures of the eyes?
Upper eyelid rejuvenation can be covered by insurance, and generally what happens is people come in, they say usually as the day progresses they have a harder time seeing, not only watching TV, sometimes driving. I refer them to an ophthalmologist. They will do visual field studies, and if they can document that their visual fields are obstructed by the excess skin, then that becomes a medically indicated procedure, and insurance will cover the upper eyelids in that circumstance. The other aspect of eyelid aging is some people come in and they're not quite ready for a blepharoplasty or don't want a surgical procedure. So by our increased knowledge, we sometimes will do fat grafting and adding fat along the lower eyelid to help restore some of that volume loss. The other thing we do sometimes is using a laser resurfacing to help tighten the skin. And for people that have more mild to moderate evidence of eyelid aging, that sometimes is all that somebody needs. People with more moderate to severe eyelid aging, that becomes more of a surgical procedure. And all these things stem from our increased knowledge of facial aging. As we start to understand more about how the face ages, our treatment modalities have really opened up, so we can really tailor the treatment plan specifically to the patient and their concerns.
Many patients who have had these types of procedures say they look rested and refreshed. For the American Health Journal, I'm Laura Windsor.